right? How do you prevent blood clots when you're going for total knee replacement? Tell us.
Awesome question. Thank you for asking, Dr. Dada. So blood clots can be a common occurrence in patients who are undergoing any major orthopedic surgery, especially knee or hip replacement surgery. And so I think the most important thing is to first of all ask the question, have you ever had a blood clot before? And if you have, that's something you need to tell your orthopedic surgeon. Say, hey, I've had a blood clot before, and let them know under what circumstances you had the blood clot. And that's important because for many of our patients who are undergoing knee surgery, we actually will calculate the risk of them developing a blood clot with the surgery. And for patients that we think are high risk, we actually will start them on blood thinning medication around the time of the surgery to prevent blood clots from happening as well. Now, we don't do it for everybody, but patients who have risk factors, we usually will think about doing that for them about the time of surgery. So that's step one. If you have a history of blood clotting, if anybody in the family's had a history of blood clotting, especially related to surgery, definitely let your orthopedic surgery know beforehand. Number two is when they are trying to get you out of bed the day of surgery and you're like, please, doc, I just had surgery. Do not get me out of bed. It's really important because the more you're able to get up and walk around and start using that brand new knee or hip, the more you are able to kind of prevent blood clots from forming. And really, the bigger risk is in people who are not able to get out of bed, who are not able to move, who are not able to mobilize that knee. And that can increase the risk. That being said, we're not always able to prevent blood clots. And so at the first sign of any unusual pain in any part of the leg, especially that's unrelated to the site of surgery, or the first sign of any shortness of breath that's unexplained, definitely let your doctor know so that they can check for a blood clot and respond to it if needed.
You know, that is so important, I think, almost for people to know before they go for surgery, right? Because you almost have to pep talk yourself. Because I think, you know, when you've already, you know, because you've gone for surgery, you're in pain, they're suddenly giving you pain medications. But if you kind of already know that another reason why I want to get up and follow instructions is not only because I want the knee to be successful so I don't get scar tissue, but I also want to prevent a blood clot, right? So I think going into surgery with just that mental awareness that, oh, when they're, you know, you're tired, you're not feeling great, you're kind of recovering from the pain, they want to get you up and out of bed knowing, hey, I do need to follow these instructions and I do need to be aware that, oh, there's more swelling. I need to be thinking blood clot. We want to prevent that because if it goes into your chest, then you get shortness of breath and pain and all kinds of things that are very unpleasant starts to happen. So yeah, thank you for that actually. And I think that's important. So I'm actually going to have my patients watch this video when they're going for surgery, just to kind of prep them and just be aware that, you know, one of the things that we want to guard against is, you know, making sure that they don't have a blood clot after surgery. And then of course, anybody who's had blood clots before, irrespective of whatever is responsible for the blood clot, at least bring it to your physician's awareness. Right? So it's like, oh yeah, that was because I was pregnant. Oh yeah, that was because I was in a plane ride. Oh yeah, that was because I had a POP. Like whatever it was, let's put that into the equation when we're calculating what your future risk is. So that's actually very, very helpful. Thank you for that. Okay,